Hey, Bloomfield, you're watching News 12 New Jersey, as local news gets.
Thanks for staying with us. I'm Janine Strafasi. It's estimated 60 million Americans are obese, with 9 million of them considered severely obese. Being overweight can lead to serious and life-threatening health problems, including diabetes and heart disease. And for many, diet and exercise are not enough to shed that extra body weight, and surgery may be an option. Joining us to talk about her struggle with weight and how she was able to shed the pounds through surgery is the co-author of Fighting Weight, Khaliah Ali, daughter of former heavyweight champion Muhammad Ali. And thank you so much for being here.
Thank you for having me.
And you know, it is a health show, so I want to mention, you know, your father. Everyone knows who he is. He lives with Parkinson's disease. How's he doing?
He's doing great. I always like to tell people he's blessed. Truly a blessed man.
He's a strong man. I mean, I've seen him in interviews. Yeah, that's for sure. All right, let's talk about your issues with weight. I mean, you're absolutely beautiful. So tell us, early on, was this always a problem for you?
Like many people who've struggled with obesity, it's something that follows you for a lifetime. You're the chubby child. You're the fat girl in school. When you get older,
looking at that picture
you
of
learn to you see
as well, yeah.
You learn to love your curves, and eventually, for some of us, tragically, it turns into obesity, and some, and far too many now, morbid obesity. So topping off at 335 pounds was a real reality for me. I discovered I had to really do something about the age of 30.
And I was looking at your book, and you know, one of the excerpts is about you and dealing with kids on the schoolyard, and how they interacted with you, and you were really teased as a young person being overweight.
Right, absolutely. Especially having a father like I did. You know, you're big bone, your feet are big, your body's big. It was an endless cycle. You know, if it wasn't the children torturing me from those years forward, it was what I held to be true about myself, which was false the following years. I told myself I wasn't beautiful. I told myself I wasn't worthy. I hid. I stayed in a small little box until I decided to get out and really make a change and do something.
And I think for young women and young girls especially, it's so traumatic to have to deal with this. Now you talk about this moment of truth you had. You said it was at the age of 30. Did this moment of truth come?
It really was, and it's part of the Moment of Truth campaign we have. I encourage people to go to momentoftruth.org. But I realized at that point I'm old enough to know better and young enough to live the life that I wanted to. I'd had this child. I wouldn't go on the beach. I'd cut myself out of photographs. God forbid something happened to me, there'd be no memory. I had meticulously removed myself. And from my personal life too, intimacy. People don't look at heavy people and realize we're sexual creatures and beings too. You know, you want to be able to have your skin, your flesh show, just to see a back. You know, an obese back with riffles is something you hide, just being very straight. And I think it's important that people understand that. And for me, I looked at it long and hard for exactly what it was and decided to make a change.
And you have a beautiful son named Jacob. I met him here. And you look at him, you look at his face, and you say, I have to do something for myself. So first off, I think people are going to say, well, did you try diet and exercise, and what did it do for you?
Whew, yeah, I lost weight, and I gained weight, and I lost weight, and I gained it. Peanut butter, grapefruit, professional diets. Sadly enough, diet pills. I've tried everything.
Everything, yeah.
You know, I needed a tool. The fact was I needed a tool. Now, bypass wasn't going to work for me for that reason, because I felt I would have been imprisoned. It's a wonderful choice for many people. It wasn't the right way for me.
So you came along, and what did you do? You talked to a lot of different people, and you found out about this procedure known as banding. Is that what it's called? Banding?
Yeah, gastric banding. I had looked at it for over 5 years, the bypass, and organically felt worried for my own safety and my long term, because I'd had friends who had bypass who were regaining their weight. With the band, I knew hunger was going away forever, because when this band is properly adjusted, it kills hunger. And for me, that was my eating issue. And two, it was adjustable. What if I wanted to go away and eat? What if I wanted to eat less when I couldn't eat less anymore? You know, so the adjustability of this was very attractive.
All right, so the gastric banding, which you write about your experiences and the gastric banding in your book called Fighting Weight, that people could certainly purchase and take a look at. But tell people in layman's terms, I mean, you're not a doctor, but what you went through, what is gastric banding to begin with? It's actually a band that goes around your stomach?
It is the most non-invasive option out there for someone looking at surgical weight loss. That's why my surgery was on Today's Show Live initially, to show people how simple. It took all of 20 minutes. In most cases, it's done outpatient surgery, and you're back to work. If operated on Friday, back to work comfortably on Monday or Tuesday.
Is it painful?
No, I never had pain. I had discomfort. I had discomfort that I took Tylenol or Motrin with.
Is that
and
right?
I'm a big crybaby, so that kind of says a lot.
Now, is it done? It's done through your belly button? Is it done laparoscopically?
Laparoscopically.
Okay.
I had little nick suri tape. I didn't even have, stitches. It was very simple.
Now, this band has to be reached by a doctor, though. You're talking about adjusting it, right? It's not something that a person can adjust this band. A doctor would have to go in.
God forbid I wouldn't have lost a pound.
And adjust this band.
I wouldn't have lost a pound. You know, it's a 3-minute skinny needle. I have a port, which I'll let you feel later, right here to the wall of my abdomen. It's sewn. And simply putting saline in or out restricts it. It causes restriction or lack of restriction. And it also, we don't really know scientifically why, when you restrict it, it makes hunger vanish.
Wow.
That's the real miracle with this. Hunger is gone.
Now, there are restrictions. I mean, you make it sound very easy, but there are big lifestyle changes that come with this, correct? I mean, after you get this band on, how do you have to change the way you live and eat?
What I have to tell you is, because the lifestyle changes aren't that huge, it really is up to you to do the work. Might be more to the point. So this is not a magic bullet. If you don't adjust this band, you're going to be able to eat as you did before and experience your hunger patterns as you did before. You won't lose the weight. So you must live on top of your adjustments. There are certain foods in the beginning you have to learn to have a relationship with. Doughy foods, red meat, dried chicken meat, so on.
Right.
You learn how to chew them or work around them. But I'm going on my 3rd year. There's nothing that I can't eat, and I know my happy adjustment.
Any complications that you've experienced in 3 years?
I had a hernia. I had a hernia going in, and because of that, now they check for hernias, at least with my one physician incoming. Other than that, no.
Bottom line, it's changed your life?
Oh man, for the better. I'd do it every month if I could or had to.
And you were what size, and you're what size now?
Oh God, never getting right to the point.
How many dress sizes
It was like
did
a
you
28, and right now I'm sitting here comfortably in a size 10. I'm not ashamed to, my weight fluctuates. I'm up like 10 pounds. It's the holidays.
Right. Who is it, right?
So I'll be back in the new year. I'll go get my adjustment and back in the new year. But yeah, like a comfortable 10.
Thanks for sharing your story.
Thank you for having
your
me.
book called Fighting Weight. We'll put that information on our website for you. Our thanks to Khaliah Ali for sharing her story with us today. Stay with us on 12 to Your Health. We'll look at the subject from the medical point of view. Dr. Alexander Abkin of Advanced Laparoscopic Surgeons in Florham Park will be here. And a reminder, if you have any questions about today's interview, or if there's a topic you'd like to see discussed on our program, email your thoughts to me at 12toyourhealth@news12.com. We'll be right back. You're watching 12 to Your Health. I'm Janine Strafasi. Before the break, we talked with Khaliah Ali, daughter of world-famous boxer Muhammad Ali, about her new book called Fighting Weight, her battle with obesity, and a procedure she underwent called banding. With more on gastric banding is Dr. Alexander Abkin, a surgeon with Advanced Laparoscopic Surgeons in Florham Park. Thanks for being with us, Dr. Abkin.
Thanks for having me.
Let's talk. What is banding all about?
Banding is a restrictive procedure for weight loss. The banding is done laparoscopically, essentially 100% of the time. I brought for a demonstration the gastric band, which is essentially a elastic ring, which get placed at the very top of the stomach.
Okay.
And then the portacath, which is used for adjusting of the gastric band to make the ring inside tighter or smaller or looser, and therefore squeeze the stomach and make patient feel full, not hungry, satisfied, eat less portions, and therefore lose the weight.
Khaliah was telling us she has basically a port on part of her stomach, where I guess that part is...
That is the port, yes, and it gets implanted kind of under the muscles of the abdominal wall, so it's not seen from outside. And we tighten the band by putting a special needle to put sterile saline to tighten the band.
How common is gastric banding? I mean, how many cases has your office done with this?
The procedure is becoming more and more popular. We've been doing this procedure in the United States since 2001, when it was approved by FDA, and we do approximately 300 to 400 procedures a year.
Is that right? Now, who's a candidate? I'm sure people at home saying, well, this sounds not that bad, but who's a candidate for this?
You need to meet the criteria established by National Institute of Health. You have to be what we call morbidly obese. Roughly, it's about 100 pounds over the ideal body weight for a male, and 70 pounds for a female. If you have medical problems such as diabetes, sleep apnea, high blood pressure, degenerative joint disease, arthritis, asthma, acid reflux, infertility, secondary to obesity, the weight does not need to be as high. So you can be 50 to 70 pounds overweight and you can meet the criteria.
And lastly, the complications. Are there any associated with this?
This is the safest procedure available on the market. It has 10 times less complications than gastric bypass. Most commonly seen complications are superficial wound infection, intolerability to foods, and occasionally there are severe complications like band slippage in about 1% of the patients.
Of course, people have to do their homework at home. Thanks so much, though, for the information. It's important information at that. Talk to your doctor. Our thanks to Dr. Abkin. For more helpful health info, log on to news12.com. While you're there, you can also check out my blog. And a reminder to watch my health reports every weekday here on News 12 New Jersey, beginning at 5 p.m. Thanks for watching 12 to Your Health. Here's to your health. I'm Janine Strafasi.